Waardenburg syndrome is a type of radial nerve neuropathy that occurs when two muscles compress a superficial radial nerve. One is extensor carpi longus tendon and the other is marked as D in the picture. Okay, D is in the picture. The compression of the radial nerve increases with forearm pronation. When we pronate, suppose we are increasing the forearm pronation, the compression of the radial nerve actually increases, which means the muscle which is responsible for the pronation is pronator teres. Maybe it might have got affected. It results in sensory manifestations only of burning pain and paresthesia over the wrist, hand, and dorsal surface of thumb, index, and middle fingers. Burning pain and paresthesia over wrist, not only wrist, but also hand and dorsal surface of thumb, index, and middle fingers. Dorsal surface, which is nothing but it is supplied by radial nerve, which is a muscle that is marked as D. Pronator teres, it is involved in median nerve. So, even immediately on seeing pronation, never click pronator teres because pronator teres it is supplied by median nerve and flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor pollicis longus, flexor digitorum profundus, pronator caudatus, it is also supplied by median nerve. So, now let us go to radial nerve. So this radial nerve, it is applying long head of triceps, middle cut of triceps, posterior cutaneous nerve form, profunda brachii, lateral cut of triceps, it is also divided into lower lateral cutaneous nerve form, and it also supplies brachialis, brachioradialis, and elbow joint extensor carpi radialis longus. So posterior cutaneous nerve form and posterior cutaneous nerve forearm are the branches of radial nerve. Now let us look at the actions of brachioradialis. It flexes the elbow joint. Action of brachioradialis is nothing but it will be flexing the elbow joint. It pronates a supinated forearm at mid-prone position. So now we have mid-prone position. So if the forearm it is supinated, it has to pronate the forearm to mid-prone position. So that type of action it is done by brachioradialis. It supinates the pronated form. Suppose if the pronated forearm, if suppose forearm is pronated, we have to supinate again to the mid-prone position. So brachioradialis helps in supinating when it is pronated. So now the patient cannot pronate, and also radial nerve is compressed. On seeing all these clues, we find brachioradialis is affected, and the picture shows a brachioradialis muscle, which is a type of superficial extensor.